Honorable Dwayne Seymour, Minister for Border Control, Labour and Culture, Sustainability and Climate Resilience and Wellness, and also the Minister of Health acting Cayman Islands. Mrs. Bobeth Ogado, acting Chief Officer, Ministry of Health. Mrs. Felicia McLean, Chief Nursing Officer, Ministry of Health. Representatives from partner organizations, CARPHA, PAHO, UKHSA, and also Ministry of Health Cayman Islands. Distinguished guests from CARPHA member states, as well as other member states, and of course those who would have joined us online. Ladies and gentlemen, it's my pleasure to say on behalf of the organizing team that we're quite pleased to have you here for this regional mosquito-borne disease workshop on networking for improved responsiveness. And I know that many of you would not have to ask the reason why it's important to have this particular activity. Nonetheless, we have attempted to organize the agenda in such a way that by the end of the 3 days that you'll spend with us, you'll be very much aware of the importance of having such an activity, and perhaps more importantly, the role that you will play in terms of ensuring that we can have a more responsive effort across the Caribbean region. So this morning, it's with great pleasure for me to call this session to order, and of course, for us to transition to the first item on the agenda. So at this time, I would like to call on Mrs. Felicia McLean, who is the Chief Nursing Officer of the Cayman Islands and has 26 years of experience in nursing. Felicia joined the Ministry of Health as the Chief Nursing Officer and expressed her passion about nursing excellence. In addition, Felicia is eager to lead initiatives to enhance professional development within the nursing profession and to ensure the highest standards of patient care in the Cayman Islands. Who else better than to welcome us to this lovely event? Mrs. Felicia McLean.
Good morning. Protocol being established. I'm going to jump right into my speech. Good morning, ladies and gentlemen. It is my pleasure to be here with you as the Chief Nursing Officer of the Cayman Islands, and to add to the wonderful welcome to this conference and to the Cayman Islands. To say that as a region we face many challenges is an understatement. Yes, the whole world faced COVID-19, but how many of them can also say they faced it while facing hurricanes and also the occasional earthquake? Yes, the whole world is facing climate crisis, but how many of them fully understand the implications of rising sea levels and the threat of simply not existing next century? Yet, we do not shy away from the challenge. Here we are this morning, having come together as a region to share our knowledge, collaborate with one another, and to integrate our strategies and maximize our resources as we unite to address one common concern: vector-borne diseases. As all of us sitting here this morning understand this threat, especially in light of the record high number of dengue cases last year, which have already been surpassed this year. Yes, there are much opportunities to learn over the next few days. Our agenda guarantees us that there will be no shortage of discussion on epidemiology, diagnostics, risk stratifications, surveillance, and much, much more. I just wish to remind you that the focus of our time together is much more, and we also want to look at networking as much as we look at the technical components of this group and the science. Our collective resilience as a region is as dependent on our relations and support of one another as it is on our national structures and systems. There's nothing quite like being a small island nation to remind us how powerful strength is in numbers. My hope for you today is that over the next few days, you will do your part to strengthen our region's ties to one another by getting to know your neighbors, connecting with one another, and that you foster these connections long after we've left here. After all, ours are a people who need people, and we are all aware of the human touch and how that opens many doors. Thank you all for making your way to our islands and to this venue. I look forward to meeting as many of you as possible in the coming days, and once again, welcome to the Cayman Islands. Thank you, and God bless.
Thank you very much, Chief Nurse. Just to say that, just from the scenery, I felt very welcome driving here this morning. And some would tell you, when I came a few months ago, they told me I'd be back soon. I said, no, man, it won't happen. And then, I found that I came back, and I found that I'm here again. So something they've done to me, I'm still trying to figure it out. But just to say that it's a very welcoming environment, and we certainly appreciate being here. And Chief Nurse in Office, if I may just reflect on what you said, you spoke about resilience and strength in numbers. And I just wanted to highlight that this activity is the product of a collaboration among different partners. I mentioned them at the start, but PAHO, UKHSA, the government of the Cayman Islands, as well as CARPHA. And I just wanted to recognize them, give a round of applause as well. Excellent. So it seems the opportune time for us to transition on the agenda. The next speaker will offer recorded presentation, and he is none other than the Chief Medical Officer of the Ministry of Health. Dr. Nick Gent is a highly experienced public health doctor who joined the Ministry of Health and Wellness as Chief Medical Officer in October 2022. Dr. Gent left the post of Senior Medical Advisor, Consultant in Public Health with the UKHSA, where he worked principally in the field of chemical, biological, and radiological threats, and the management of major incidents and severe public health threats for the last 20 years. Prior to this, Dr. Gent worked in District Public Health Services as Director of Public Health and as an executive member of Service with Responsibility for Public Health, health protection, and developing and commissioning a wide range of healthcare services. Ladies and gentlemen, join me in welcoming Dr. Nick Gent.
Ladies and gentlemen, colleagues, welcome to the Cayman Islands. I apologise that for personal reasons I cannot be with you today, but hope that you have both a very productive conference and enjoy your stay on our islands. Vector control and vector-borne disease management are inextricably intertwined. The challenges on control are numerous, not the least the public perception of risk and benefit that bring conflict in our decision making. It will not be a surprise to those of you that have significant tourism investment that here, for example, in the Cayman Islands, we have an industry that wants no mosquitoes biting their guests, even if they are not disease vectors, and a local population that has more concerns for chemical exposure risks, especially to their children. Removing risk, real or perceived, from traditional chemical controls is, I suggest, never going to be achievable. And so research and development of ecological controls are now more and more important. I'll be very interested in receiving feedback after the conference from my colleagues on your thoughts on this matter. I'd also observed that our behavioural sciences colleagues are becoming more and more important to us, not just in areas of effective communication, but also in terms of motivating community actions to limit vector populations, especially in the reduction of risk from what are largely domestic vectors, such as the Aedes aegypti. Turning to the vector-borne diseases themselves, we live in interesting times. Most remain untreatable, many can cause very severe illness. Our diagnostic abilities are outstripping our ability to control and treat, leaving us in the strange situation that we can potentially diagnose and describe the emerging epidemiology of these illnesses, but can be relatively powerless to intervene at the environment, vector, population, or patient level. We also live in a region of immense differences in resources, and we must be very careful that we have those differences clearly in mind, especially that we do not criticise countries that have more limited ability to control, diagnose, and treat. We face a common problem of similar environments, tropical climates, shared diasporas in regular communication with each other, and common vector populations. We need to support each other, and I sincerely hope that this conference helps us to take forward the cooperation and common feeling of care and respect that we have for each other that is so characteristic of the Caribbean region. Thank you for listening to me, and all my best wishes to you all for what I hope will be a very successful event.
Excellent. And you really know how effective a speaker is when your attention can be captured even though it's a virtual delivery. So we thank Dr. Gent so much. And just noting too that Dr. Gent was a key visionary in suggesting that we have this activity. So just wanted to acknowledge that the idea was born with him and of course shared with the team. So we're happy to be here. Having said that, we've come to the point of having the feature address. And as public health professionals in the room, I'm sure that we can appreciate that just having the technical orientation doesn't quite suffice. You need political will, right? So I'm quite pleased that we have the Minister of Health acting here with us, who will be delivering the feature address. And Dwayne, John, I'm told, Seymour, is a son of the soil who grew up in Gun Square's central Bodden town. Minister Seymour was first elected in 2009 and has been serving the people of the Cayman Islands as an elected representative since that time. Minister Seymour has previously served as Minister for Community Affairs, Gender and Housing, Minister of Health, Environment, Culture and Housing, as Deputy Speaker and Parliamentary Secretary for Housing, Transport and Labour. He is currently the Minister with responsibility for border control, labour and culture, sustainability and climate resilience, and wellness, and joins us today as the Acting Minister for Health. Ladies and gentlemen, it is our privilege to welcome the Minister of Health Acting, Minister Seymour.
Hi, good morning, ladies and gentlemen. Good morning, ladies and gentlemen.
Good morning.
I also taught customer service. Protocol has been ably established. I want to welcome CARPHA and the international delegates here in Grand Cayman. How are you doing this morning? I hope your flight was okay and your hotel is good. And I want to tell you a true story. I saw some people with some long faces and I said, should I tell them? And last night, I got my speech and I read it and I saw vector-borne diseases. So I started to research it. And what did I do to myself? I couldn't sleep last night. And especially after a rainy weekend, a disease that results from an infection transmitted to humans and other animals by blood-feeding arthropods, such as mosquitoes. Now, if you grew up in the 70s when I grew up, mosquitoes was the thing. And when I got home last night, what was at my door? A bunch of mosquitoes flying around, and I swatted over my head, trying to run them away, but these guys were brave. And I said to myself, don't tell me I'm going to be bitten tonight before I give a speech on vector. So I opened the door and flew inside, only for some of them to follow me inside. And I haven't slept all night because I kept waving over my head. For those who grew up in a mosquito-borne area, you know they get inside, and you know that you can actually hear them even if the sheet is over your head, making that beautiful song of meh. And I've never been afraid of mosquitoes until I kept reading on and on. So the lesson is, don't read about vectors before you're going to speak about them. My apologies, I'm just arriving late. Ladies and gentlemen, I am indeed honored to welcome you on behalf of the Honorable Premier, Minister of Health, Juliana O'Connor-Connolly, to this important gathering convened to address one of the most pressing public health challenges of the time. Over the next few days, our focus will be on the vector-borne diseases, including arboviruses like dengue, Zika, chikungunya, and yellow fever, which are expanding into new regions, straining healthcare systems, and disproportionately affecting the most vulnerable of us. This meeting let us begin by asking, what is the nature of this challenge? Arboviruses are not abstract issues confined to the medical journals or reports. They are a real and growing threat impacting the health and livelihoods of millions across our region. In many cases, these diseases have already become a heavy burden. In others, and there are emerging threats on the horizon, limited resources in many of our countries add to the complexities, requiring us to carefully balance prevention, detection, and treatment efforts. So how do we meet this challenge? The answer lies in collaboration across borders, disciplines, and approaches. Arboviral diseases are inherently complex, and they demand solutions that draw on the best of epidemiology, vector control, public health, climate science, and community engagements, among other fields. By bringing together our expertise and resources, we can have a meaningful and lasting impact. The biggest purpose of the Cayman Islands government is to make the lives of those we serve better. And to that end, we have developed 5 strategic broad outcome and specific actions aimed at achieving these outcomes through the delivery of government programs, cabinet policy actions, and legislative changes. Of the 5 broad outcomes developed by our government, 2 are particularly relevant to the spirit and aims of this meeting. Broad outcome 1 compels us to implement or draft policies, initiatives, and priorities that benefit our people and the improvement of the quality of life, both as individuals and collectively. This outcome speaks to providing solutions to enhance the well-being of our people so they can achieve their full potential. Broad outcome 3 speaks of future-proofing our society by anticipating risks, assessing opportunities, and taking the necessary steps to ensure the health and prosperity in the Cayman Islands. This meeting is an opportunity to align our efforts with these broad outcomes, ensuring that we address not only immediate challenges, but also long-term resilience and prosperity, not only for the Cayman Islands, but the whole Caribbean region. Our collaboration also calls for us to harness the full power of science, data, and human ingenuity to strengthen our response. We need coordinated efforts that involve environmental scientists, microbiologists, and behavioral experts to maximize the impact of our work. Even with limited resources, we can innovate and operate more efficiently by avoiding duplication and strategically deploying our assets. We can extend the reach and effectiveness of our efforts. For example, shared data systems, collaborative training programs, such as the recently held CARPHA Mosquito control workshop and regional research initiatives can significantly improve diagnostics, enhance surveillance, and expand community outreach. But we cannot stop at the immediate challenges. Climate change and increased human mobility create ideas, conditions for arboviruses to spread, and they also raise the risk of new unknown threats. Preparation for these realities is essential to building our resilience. Ladies and gentlemen, none of this can be accomplished alone. Regional collaboration is not just an option, it is necessary. By working together, we can share proven strategies, foster innovation, and develop sustainable partnerships that will help us face these challenges head on. Our hope is that this conference will spark new ideas and inspire real actionable changes, actionable outcomes that will strengthen public health across our entire region. The work we will do here over the next few days has the potential to protect millions. And I look forward to engaging with each of you as we move towards the shared goal. Thank you, and may God bless you in these beautiful Cayman Islands.
Thank you very much, Honorable Minister, and thank you for giving us the vision in terms of taking this to the next level and continuing the collaboration as a team. And of course, Minister alluded to the environmental components, behavioral change, and the need for us to really have a multidisciplinary approach. So that's very much appreciated. And it shows that at least in the design of the agenda, we factored in those key components. So we hope that we can really pull it all together, that it can lead to a more effective response across the Caribbean region.